Most chronic low back pain keeps coming back because it was never actually measured or corrected. If you've been stretching, getting massage, or taking medication and nothing lasts, you may be missing a structural problem called loss of lumbar lordosis. I see this all the time. After reviewing hundreds of spinal x-rays, patients are told it's muscle spasm, but their lumbar curve is never measured. In this video, I'll show you what a normal lumbar spine should look like, how to tell when that curve is lost, and what it actually takes to correct it. And what we see when it is corrected is less pain, better movement, and improved day-to-day function. Now stay to the end, because I'll tell you about my patient Harry, who had chronic low back pain and a loss of his lumbar lordosis. I'll show you how we helped him get back to full-time work and handle the physical demands of his job with less pain using the non-surgical corrective methods I will describe in this video. I'm Dr. Graham Jenkins, one of only a few advanced certified CBP doctors in the world, and I lead one of the only clinics of its kind in Western Canada, located right here in Kelowna, British Columbia. My team and I help patients restore their health, mobility, and confidence through non-surgical spinal rehabilitation. My mission is simple: to help people live strong, active, and pain-free lives for as long as possible. We do that by focusing on real correction, not just pain relief, helping people fix the root cause of spinal problems that have held them back for years. On this channel, you'll find clear, evidence-based videos that explain how your spine and nervous system work, why posture matters, and what you can do to move and feel better naturally. So if you're ready to take control of your health and start moving without fear again, subscribe to the channel. You'll discover practical, evidence-based ways to correct your posture, protect your spine, and keep your body strong for life. I upload a new video every week. Before we can talk about loss of lumbar lordosis, it's important to understand what a normal lumbar spine or lower back looks like. Now, from the front, it's fairly logical. The spine is straight, but from the side, it has three distinct curves. In the lumbar spine, this curve is called a lordosis. So studies by chiropractic biophysics established that the ideal lumbar lordosis from L1 to L5 measures 40 degrees, and it follows an elliptical shape. So the deeper part of the curve should be at L4, L5, and L5 and S1, so at the very bottom. As you move up into the upper lumbar spine, the curve becomes naturally flatter. This design helps absorb shock and protect the spine and your spinal cord under load. When the structure is aligned normally, the spine can tolerate all the daily stress from sitting, standing, and lifting more efficiently. Many patients with chronic lower back pain have never had their lumbar curve measured with weight-bearing or standing x-rays. Instead, they're just told that their symptoms are caused by muscle tightness or muscle spasm. So many people are left to manage their symptoms with medication, stretching, or massage, rather than understanding why their symptoms are happening in the first place. This becomes frustrating and counterproductive to moving and feeling better. Loss of the lumbar lordosis means that the curve falls below what is considered ideal, which, as I mentioned, is 40 degrees for most people. Detailed spinal modeling research by Dr. Donald Harrison and his team showed that when the lumbar lordosis drops below 35 degrees, there's a strong correlation to chronic low back pain. Here's what happens when there's a loss in the lumbar lordosis. The loads acting on the spine begin to shift. The stress puts more pressure on the discs, and it leads to disc damage. The spinal joints become irritated, muscles begin guarding and tightening to stabilize the area. Over time, this will cause stiffness, reduced mobility, pain, and back flare-ups that keep returning. Now, if that structure is not measured, the underlying cause of these problems can never be resolved. That's the risk of doing treatment that focuses only on relief of symptoms versus correcting the underlying structural issues. At this point, a common question often comes up with new clients in my office. What if my back is straight because of muscle spasm? Well, it's true that muscle spasm can influence posture. When the body's in pain, muscles tighten to protect the area. That protective response is totally normal. But muscle spasm typically changes alignment only by a few degrees. It doesn't usually account for a significant loss of lumbar lordosis below 35 degrees. That has been established in the research. When we see a measurable structural reduction on a full spine X-ray, especially one that's developed over time, that's not just temporary muscle tightness. That's structural adaptation. The spine has remodeled and adapted into a compromised position. And if that problem is structural, it must be addressed structurally. You may have found that stretching provides temporary relief and massage reduces muscle guarding. But within a few hours or days, you're right back to where you started. Some of my patients have been prescribed medication that may calm inflammation. But just like the stretching and massage, it doesn't correct the underlying alignment. Now, it's important that you don't think I'm discounting the value of massage and stretching. I'm not. In fact, I've written several books on the topic of stretching and activity-based rehabilitation. So I'm a big believer in stretching and getting some help with soft tissue by a good massage therapist. But, here's where the but comes in. Like my grandpa was often heard saying, there is a right tool for the right job. And if you have lost some of your lumbar lordosis, more stretching and more massage will only address the symptoms temporarily. A structural problem requires a structural solution. This is why so many people with chronic low back pain feel stuck. They're only treating the symptoms. They're not addressing the loss of the lumbar lordosis itself. And as I mentioned earlier, if you don't measure the lumbar curve, you have no way of knowing if you have lost your lumbar lordosis. So the real question becomes, what does structural correction actually involve? And what does it realistically take to change that curve? If loss of lumbar lordosis is contributing to lower back pain, the correction can't be passive. Structural change requires a structured plan and shared responsibility between the doctor and the patient. In our office, we use a 3-part corrective care approach. That's the foundation of chiropractic biophysics. This approach is built around mirror image techniques. That means we position the spine in a mirror opposite position to how you presented in your X-ray evaluation. If your lumbar lordosis is reduced, we guide the spine into alignment to begin restoring the natural curve. This is done in 3 specific ways. That together are the core of the CBP correction method. The first part is mirror image exercises. These are specific exercises designed to retrain posture and reinforce the corrected position. The second part is mirror image adjustments. These are delivered while your spine is positioned in its mirror opposite alignment. The third part is mirror image traction. This involves sustained spinal positioning using specialized equipment to help create measurable structural change over time. At home, specific exercises and traction must also be done consistently to reinforce the correction. We prescribe our patients home spine orthotics. So if you've seen some of my videos, you've seen these before. So this is the lumbar roll and lumbar extension exercises. I show you these techniques in my other videos, which I will link in the description below. All of this is part of a structured treatment plan. The patient is seen 3 times per week for about 12 weeks or 2 times per week for 16 weeks. Reevaluation is also critical. Follow-up assessments, including x-rays, allow us to measure whether your lumbar lordosis is actually improving. So as you see, this is a collaborative effort. The best results happen when the doctor and patient work together. Now let me show you how this works in a real case. Harry is a construction worker, and he came in with chronic low back pain, radiating leg pain, and hip pain. His job requires full-time physical labor. He goes up and down ladders every day. That's not optional. When he first started care, climbing ladders was painful and difficult. Even driving was a problem. He had to stop every 60, maybe 90 minutes just to stretch. So we began with robotraction because of the severity and irritability of his condition. You can see how we use RoboTrack to correct loss of lumbar lordosis and other spinal conditions in my other videos on my channel. I'll drop links to those videos in the description below. This is an example showing what a loss of lordosis looks like on x-ray. So alongside that, we gave Harry posture-based corrective strategies and specific home exercises. Like some of my patients, Harry's home exercise compliance was not perfect. But Harry was fortunate. Even though he didn't do his exercises as faithfully as I would have liked, he was still able to get good results. So at approximately 8 weeks into care, his radiating leg pain started to improve. We made more space for the nerves. He was still experiencing occasional flare-ups at work, but the overall trend was positive. He continued working full-time. He was able to go up and down those ladders with less pain. His driving tolerance also improved. He only had one setback after he helped a friend move, which I didn't recommend, as Harry is the kind of guy that is a bit of a bull in a china shop when it comes to getting things done. The one positive out of helping his friend move, Harry recovered much quicker than he usually would have because his spine was moving and positioned better. I still would have preferred if he not lift on his friend's couch, but that's life in the real world. Now, in Harry's reevaluation, we measured on average a 30% reduction in his initial postural distortions on the front view and more than 50% improvement in side posture, which directly relates to the lumbar curve restoration. So here's the key takeaway message. You don't have to be perfect to make progress, but you do need the right approach and consistency over time. So if your lower back pain keeps coming back, your spine may not have been properly evaluated, especially if you've tried stretching, massage, or medication and nothing lasts. You might be like a lot of my patients who've been told it's just muscle tightness or muscle spasm. You might want to dig a little deeper, especially if you've never had a full spine weight-bearing or standing x-ray and a true structural assessment. That may be the missing piece. Loss of the lumbar lordosis changes how forces move through the spine. That can lead to disc stress, joint irritation, and muscle guarding. Over time, that shows up as stiffness, reduced mobility, early arthritis, and flare-ups that keep returning. The key point is this: spinal structure matters, and it can be measured. It needs to be measured. Now, with the right approach, progress can be tracked, but it takes consistency and a team effort between you and your doctor. So that means you'll have homework to do if you really want to beat your pain and stiffness. If you're frustrated with lower back pain, leg pain, or stiffness, or your lumbar lordosis has never been looked at, it might be what's missing. If you've made it this far in our video, you should now have a much clearer understanding of what loss of the lumbar lordosis is, why it can contribute to chronic low back pain that keeps coming back. You should also understand that spinal alignment can be measured, and that treating symptoms without assessing alignment often leads to the root cause being unaddressed. So if you've never had a full spine analysis and x-ray, consider seeing a corrective care chiropractor who is trained and certified in chiropractic biophysics. Proper structural assessment matters. If you need help finding a qualified CBP doctor, let me know in the comments and I can direct you to the online doctor directory. And if you're in the Kelowna, British Columbia area, come check us out. I'd be happy to see if we can help you. If you found value in this video, like and share it so more people struggling with chronic low back pain can better understand what may actually be causing it. And if you're ready to take control of your health and start moving without fear again, subscribe to the channel. You'll discover practical, evidence-based ways to correct your posture, protect your spine, and keep your body strong for life. Now, if you want to see how we use CBP lumbar extension traction methods to correct a loss of lumbar lordosis, watch this video next. I'll show 3 different types of traction that we use in our office, and you'll see the corrective traction method I talked about in today's video in action. Go watch this video next.